I think you have to end poll results, maybe.
Okay. Aha. Okay, I think we have it now. Thank you.
Okay, you can see my screen?
Yes.
Okay, great. Well, thank you for the introduction, Pam. As she said, my name is Leigh von Hagen, and I work at Rutgers University as part of the Planning Healthy Communities Collaborative. I both conduct health impact assessments and teach students in continuing ed classes on how to conduct HIAs. And I'm going to start with a bit about what is a health impact assessment, and we'll give examples that show the value of conducting health impact assessments. So briefly, where we live, learn, work, and play are significant contributors to our health. And the problem is many of our daily policy decisions are made outside of the health sector, but have significant health implications that go unrecognized because health is not on the radar screens of decision makers. To put it briefly, a health impact assessment is a tool to understand the health implications of proposed policies, plans, or projects on communities. Another way to look at it is how might a proposed plan, project, or policy affect air quality, water quality, livelihood, education, social networks, nutrition, transportation, housing, noise, safety, parks, natural spaces, inequity, private and/or public services, and lead to predicted health outcomes. A health impact assessment is a structured but flexible process that informs and influences the decision maker and translates that information into feasible recommendations for balanced, well-informed decisions that maximize benefits and minimizes health risks. The other purpose and functions of HIAs, and this is also according to the World Health Organization, who has been working on HIAs for decades, it places public health on the agenda and not as circumstantial outcomes, promotes working across sectors and including public health professionals at the table for decisions, reduces conflict between stakeholders and helps weigh trade-offs to understand the direct and indirect health impacts of a policy, plan, or project, and includes strong community engagement from businesses and other decision-making bodies and puts addressing health inequities at the forefront. In short, an HIA predicts anticipated health outcomes of a proposed decision or project and is the framework that translates the data into information and uses it to inform the decision-making process. There are many types of decisions that can benefit from an HIA, including policy decisions by the federal, state, regional, county, and local municipal and school governments, policy implementation once a decision has been made, projects that are going to be carried out but need input on siting, permitting, design, or construction, and comprehensive plans including municipal master plans and regional growth plans. Some examples where HIA have been used include building or expanding roads, creating local school siting policy, building an out-of-town shopping center, addressing agriculture policy, addressing paid sick day policies, assessing low-income energy assistance, and building casinos. Sometimes it's helpful to understand what an HIA is not. Sometimes there is confusion over what an HIA really is and when in the decision-making process it is applied. An HIA is not used to make the case for why a policy, program, or project should be proposed, and it's not an assessment that is done to understand the impacts of a program or policy once it's been implemented. It's also not a community assessment meant to gather baseline data for existing conditions. A health impact assessment can be scaled to fit the available timeline and resources for any decision. There are 6 steps that guide the HIA process. Stakeholder engagement is an underlying principle woven throughout all 6 steps. Step 1 is the screening phase, which will determine whether an HIA will add value to a decision. An HIA practitioner will ask, is an HIA needed and will it be useful to the decision process? Step 2 is the scoping phase to develop a plan for the HIA. A practitioner will ask what health impacts will be considered and what populations will be affected. Step 3 is the assessment phase, where an HIA practitioner will identify current and predicted health impacts and identify what changes may occur from the decision. Step 4 is the recommendations phase, where an HIA practitioner will identify actions that protect health. The reporting phase, and step 5, communicates findings and recommendations, and finally, step 6 monitors the impact of the HIA on the proposed policy plan or project or program to find out if the HIA helped to change outcomes. HIA's emphasis on engagement is one of the things that distinguishes it from other decision support tools. There are many ways a health impact assessment provides value to the decision-making process. HIAs are informative. They apply to a decision about a policy or project that might not otherwise focus on health. They are data-driven. HIAs provide solid research and best practice on social, economic, and environmental determinants. They're collaborative. The HIA process engages stakeholders during every phase in the decision-making process. They're pragmatic. HIAs are focused on providing timely, useful judgments based on available knowledge rather than elegant quantitative models. And they're focused. HIAs provide feasible recommendations that can help minimize risks and maximize health benefits. So I'm going to tell you about some transportation-related HIAs we have recently completed in New Jersey. In every HIA, it's always difficult finding local data. One way we address local data is through community input. We combine several methods, including online surveys, targeted interviews, and various forms of focus groups, roundtables, community meetings, and visiting target populations directly when possible. For example, an HIA was conducted for the Middlesex Greenway in New Jersey. It was being underutilized, and township officials wanted to understand why. A well-designed community survey can support the health data we found and provide evidence for predicted health impacts. Our survey garnered responses from over 600 individuals, and it was a great community engagement tool to see how people really felt about the Greenway. We found some interesting facts about who lives near the Greenway. There's a high percentage of elderly persons aged 75 and older near the trail. This influenced our public involvement. We ended up visiting a senior facility near the Greenway for a lunch discussion about using the trail. And this was a typical comment. I always wish there were benches. Lots of times I just need a place to rest and a place to relax. The county had decided not to put benches along the Greenway because of constrained space and loitering issues. However, they were not aware of the large percentage of elderly living near the Greenway. Since this HIA, the county has worked with the seniors to identify locations and install benches along the Greenway. There were a few questions on our survey regarding the amount of physical activity community members usually get, like this question, for example, which tells us how much more people are exercising now that the trail is in place. Physical inactivity is expensive. In order to find out how expensive, we researched the medical costs related with inactivity and came up with a range of medical costs from $615 to over $800. The trail is saving people $615 to $800 per year. To relate this back to the Greenway, we took the 24% of survey respondents who reported that the Greenway had increased their level of activity a great deal and multiplied by the low figure of $615 to find out that the trail already yields a benefit of over $55,000 per year in medical cost savings. The Bloomfield Complete Corridor Plan was a project that was initiated to address transit, pedestrian, bicycle, and crash issues along Bloomfield Avenue. Our health impact assessment was requested because leaders in the community wanted to make Bloomfield Avenue a more complete street, accessible for all users. Bloomfield Avenue is a county road that connects suburban and urban areas of Essex County, New Jersey, including the city of Newark. Bloomfield is a principal arterial for cars and trucks and a major transit corridor with bus, rail, and shuttle service. The portion of Bloomfield Avenue addressed by the HIA is an undivided highway with 4 lanes of motor vehicle traffic, 2 lanes in each direction, with parallel parking along both sides. For the entire study area length, the Bloomfield Avenue is a destination for shopping, dining, living, and accessing schools and services. The 4 communities along Bloomfield Avenue wanted the county to consider implementing a road diet to reduce the number of travel lanes from 4 to 3. When we explored vulnerable populations in the area, we did not find a lot of difference in the population of our study area versus the county as a whole. However, there is a higher percentage of elderly in certain pockets along the corridor, and the Hispanic population in the town of Bloomfield is larger than in the county. We also conducted a survey of all users of the road. Our online survey yielded over 1,000 responses. Half of the people surveyed who walk on Bloomfield said they thought it was unsafe. Local stakeholders told the research team that some in the Hispanic population more frequently walk and use bicycles to get to jobs at restaurants, raising equity issues. This table shows that households making less than $50,000 per year were more likely to use Bloomfield Avenue to access work and to access public transportation than those making more than $100,000 per year. This is a quote from the survey that represents the frustration of drivers. I feel as though other drivers are incredibly aggressive when driving through Bloomfield Avenue. It's a very busy county road, but I have never experienced this level of aggression anywhere else besides a major highway. Members from the local business improvement districts were also key supporters of the HIA. However, during our outreach, we heard from many who avoided the corridor due to safety concerns, like the quote from our survey from this respondent. I'm either passing through or if shopping, I'll park off Bloomfield Avenue, so I'm never walking on it for very long. As you can imagine, comments like that are very concerning to the local business districts. Our HIA considered the impacts of a potential road diet along Bloomfield Avenue. As an example of one of our predictions, we took 4 years of pedestrian and bicycle crash data and applied the current established standard from the Federal Highway Administration in expected crash reductions when a road diet is implemented. A 19% crash reduction is a conservative number, but shows an ultimate savings of $2 to $6 million in household income from reduced injuries and saved lives. Our Rutgers University Bike Share HIA was just completed last week. I have the pleasure of working with some of the best planning students in the country at Rutgers Blaustein School of Planning, which is my little gratuitous plug. This semester, we held a studio to complete an HIA for a proposed bike share system that would serve not only the university, but also local residents in the 3 towns the university occupies. Our students produced a map of the Social Vulnerability Index for the area. Social Vulnerability Index refers to the resilience of communities when confronted by external stresses on human health, stresses such as natural or human-caused disasters or disease outbreaks. They then combined the social vulnerable map and overlaid existing bicycle facilities, including bike lanes and parking. The red shows areas with high percentages on the Social Vulnerability Index with low or no existing bicycle facilities. This map helped our students recommend ways to implement the future bike share program in areas where people may benefit most. This HIA includes a section of recommendations that are specific to equitable implementation, including providing cash options for lower income populations and subsidized memberships. Recommendations also include estimates of cost, an indication of quality of evidence, and how to monitor and implement the outcomes. These are just a few examples of HIAs. One of the most frequent questions about HIA we get is how much does it cost and how long does it take? All I can say is it depends on the project. We have had success in combining HIA to existing projects. For example, the Greenway and the Road Diet HIAs were conducted as part of larger planning projects. We were able to tack on our HIA to existing public outreach plans and completed them with the overall project time frame that was already determined. Another frequent question is, when is an HIA appropriate? Of the 6 steps of conducting HIAs, one of the most important steps is screening. It's not possible to carry out an HIA on every project, policy, or program. Therefore, screening is used to systematically decide when to conduct an HIA. There are several screening checklists that can be used to help decide if an HIA is a good idea. Typical questions include, does the decision already consider health? What is the timing for the decision? And especially, are the decision makers supportive? These and additional questions can help determine the feasibility of an assessment. HIA is just one tool in the toolbox and should be conducted when it will add value or bring something new to the discussion. There are many resources to help conduct HIAs. I highly recommend reviewing the Minimum Elements and Practice Standards by SOPHIA, which is the Society of Practitioners of Health Impact Assessment. So that concludes my piece of this presentation, but you can visit us at phci.rutgers.edu to learn more about how we're doing health impact assessment and also find health impact practitioners. Thank you. I'm now going to share this screen over to Chris. There we go. All right, Chris.
Okay, is that showing up?
You're on.
All right, excellent. Well, thanks everybody for tuning in. I appreciate it not only as a speaker, but also as the current board president of the society. It means a lot to us that you're tuning in, especially this week before all the holidays. So thank you once again. So my experience with HIA has been ongoing for about the last 6 years. I learned about HIA, really kind of just stumbled upon the term and just continued down that rabbit hole about wanting to find out more and more about what it was, how it was used, and so on and so forth. And the next thing you know, I'm doing one in Haywood County, North Carolina, and then we're doing another one in North Carolina, and so on and so on and so on. And before you know it, and to date, we're now up to about 15 health impact assessments. Many of these dots, as you can see, are through different states. The only one I wasn't directly a part of was the one in Anacortes, Washington, that was an Alta product before I came aboard with Alta just a few months ago. Prior to Alta, I worked for myself, a company called Vitruvian Planning, for about 5 years, in close connection with a good colleague of mine who was at the time based in Asheville, and now we are co-workers at Alta, and excited and happy to be there. So we've had a lot of experiences, and you can see in this slide a bit about the types of HIAs that we have done. Many of them have been in the transportation realm, specifically the active transportation realm, but not all of them. And certainly with respect to populations, those have varied considerably. For example, we've done in Buncombe County, North Carolina, home of Asheville. That was an overall population well over 6 figures, and this branch library here in Boise, where our population is well over 200,000, although the neighborhood that we specifically worked in was considerably lower than that. And then in other areas, we've worked on specific HIAs where they've actually gone down to 6,000, 20,000. And so I just wanted to kind of illustrate that our experience has been with big groups and small groups and all sorts of in between. And also one thing to note is different political climates. That's a very critical thing for those of you thinking about HIA to sort of understand. We've worked in areas that would probably be considered very supportive of doing this kind of an endeavor, whereas in other areas that would be a deep-rooted skepticism, possibly, and having to kind of walk that tightrope in some cases is very legitimate. So yeah, we've had a lot of good experiences and on a lot of topics, and it's been a lot of fun. So I want to talk to you a little bit about methods, and those are really can be found again within the SOFIA documents and some of the other guidelines that have been put out over the years. But some of the things that we typically do is, especially on our rapid style, which I'll get to in a moment, but we always have good workshops. We try to get as many stakeholders around the table as we can, and really a good diverse set of stakeholders. Even people you wouldn't think to invite probably have a say and an opinion about whatever is being proposed. With respect to background research, you can see here Community Health Assessment Census. One of my favorite sources is Community Commons, which was a website that's put forth by Tyler Norris out of Southern California, and awesome source if you've never used it. We try to get into all these other topics as well. I'll get into equity analysis momentarily. Field analysis, that's another major piece for us. I'm a practicing transportation planner and have been for over a decade. And I can say that especially on active transportation projects, if you don't get out and take a look around for yourself and with your groups, then you're kind of missing the mark, because you can only get so much when you're sitting around a table. It really is important to get out and see, feel, hear everything that's happening within the field. Measuring project goals and objectives, that's absolutely essential. Having project goals from the get-go and those things that are measurable is very important. If you don't, you could end up going in all sorts of different directions with your HIA. So it's important that the group, before they really get going on an HIA, understand what is it that you really want to understand about whatever's being proposed. And then some of the other things that Leigh already had talked about with respect to interviews and surveys. So as I mentioned, there are a number of different types of HIAs, everything from a desktop HIA, which is exactly what it sounds like, all the way to the other end of the spectrum, which is more of the comprehensive HIA. With respect to budget and time and all that, just to give you a sense in my experience, rapid HIAs, those can be done in essence from around, I've seen on the low end about $10,000 all the way up to about $25,000, and can take anywhere from 3 to 6 months. And so when you get into a rapid HIA, you're probably looking at trying to understand 1 or 2 specific objectives of your HIA, and you're much more refined on what your analysis actually is trying to determine. On the opposite side, a comprehensive HIA can certainly get into a 6-figure budget. It could get into anywhere from a year, maybe even 18 months, and that's obviously going to be a much more complicated proposal. And those can really range. We nearly got involved in one that, for example, had to do with the transport of coal from Wyoming to the West Coast to be then transferred offshore to another country, and what those impacts might look like through the communities in which those trains and the frequency of trains were going to be. And so that would have been, a significant and very, very in-depth comprehensive HIA, just as an example. To get into some of the product, and what does it look like? What are some of the things that come out of it? Here's just a few slides on that. Here was one we did in North Carolina where you see again in Wake County, many of you in the East Coast know where that is, leading causes of death rates for African Americans compared to white population, and getting into the equity discussion. Some of the numbers we were finding were staggering, and you can see some of the percentages that were higher than non-African American populations. We're doing one right now here in my neck of the woods. It's an offshoot of HIA, but related, where in Idaho, specifically in the area that we're working, we don't have a high African American population, but we certainly have a higher Hispanic population. Well, some of the numbers that are coming out of that are really quite staggering, frankly. If you look at the percentage of death by age group and in the Hispanic versus non-Hispanic, you'll find that throughout our state, and this is similar in other places as well, if you go to, say, age 25, well, the non-Hispanic population, the total number of deaths from that group and below, is about 5%. In the Hispanic population, that's closer to 18%. So 18% of deaths in the Hispanic population in our state, happened before the age of 25. That's staggering. What do you do with that information when you're looking at a proposal, for example? How do you utilize that information and take the appropriate steps as much as possible? In this slide, you also see in the bottom right, we looked at, in this case, it was an active transportation HIA, and we've found that there was clearly a disproportionate number of folks within the African American population who were victims of pedestrian crashes. In fact, it was double, yet despite the number of African Americans in the state being much less, proportionately speaking. So how do you use that information? How do you program things, work with safety and outreach and all of the different areas, specifically with active transportation in this case, based on some of those findings? Other things that we've used, this was one in Logan, Utah, just north of Salt Lake, population of about 50,000, and they asked us to do a health impact assessment on a county or a citywide bicycle and pedestrian plan. So we tried to get into forecasts, and I particularly try to do that. You can see on the graphic to the left, 5, 15%, so on, to give people a range, because there's no way we're going to be able to predict with specificity exactly how many trips would be taken in this case on a proposed trailway. But it does give us at least a range and an understanding of what types of impacts can be made. So it's a little more generic, but that's okay. In this case, that's works, and again, it just kind of helps to illustrate things. And then on the lower right, you see we had a few different categories of health impact, use impact, and financial impact. And this is just a cutaway of one page of that particular health impact assessment that we did. Another category or another tool that we use often, and I can't speak to this enough. This has been a tool for me particularly that is very, very helpful, and I would certainly encourage you to think about using it. We didn't create it. It came out of the University of Wisconsin-Whitewater about 30 years ago, frankly. But the 7 dimensions of health and wellness. And so a lot of folks, when they talk about health and they get into HIA, we start thinking and gravitating directly toward physical health. Not all, but a lot. And some start to get into other things like the economic impact and stuff. But what we find is by using this method, this particular model, it helps to frame and remind ourselves that health, it comes in various forms. So we'll use this to really also drive discussion and to really, in terms of look at field analysis, we'll start to piece some things like this together, and it's very helpful. So if it's an active transportation plan, or really, and we did this for the library as well, starting to understand where are the places within your community that are maybe proximate or we want to connect to, or whatever, however this might be helpful, just so that folks understand that there's a lot more to a community than what's being proposed directly. We can start thinking about things in other ways. And when you think about something like a greenway, for example, how does that get to emotional health? Well, I'm guessing in the surveys that Leigh did, for example, there's probably a lot of stuff that came out that really highlighted how that trail got to it, and the content and quality of life and all of those things. So it's just a good reminder, I think, of an approach that can be utilized, and that our community is much more dynamic than just physical health. Logic framework. This is one of the required elements of a health impact assessment. And I've seen lots of different examples. I'll show you a couple. So this is just one. This was one that we did early on. In fact, if I did it again, I'd probably make some changes because we've learned so much in doing these things. But it's a reminder that we might have a particular claim or an idea at first in the first category, so constructing greenways in this case. And oftentimes what I have found, my experience has been that people tend to gravitate all the way to the opposite end of that logic framework, which is what are the impacts going to be, and want to just sort of, I guess, instinctually go right to, hey, yeah, everything's going to be much better, people are going to be happier from a physical, mental, and so on and so forth. But it's important to remember that it's this middle piece that is just as important, and understanding that, the first steps are critical. How do we get those first steps to occur, and what are those first steps? So here's another example. It's a little more graphic, which can be very, very helpful for decision makers and the general public, as opposed to, this form, for example, might be much more appropriate for public health professionals and specific stakeholders. This might be something that can be useful for distribution, media, what have you. So in this instance, you can see there's the proposed action is in the upper left, which is in the blue box, so South Commercial Avenue. In that case, it was to do some redesign of that street and road diets and the whole 9 yards. So we had a few initial steps that would come from it. So if we just follow some of these lines and say, okay, increase separation between vehicles and bikes and pedestrian. Okay, so we know that when we physically construct that, that's what the first step is going to be. Not that all of a sudden everyone's going to be out walking, biking, and being super active. Nope, there's this intermediate step that needs to take place first. And once you get past that, then you can start to see, okay, reduces stress of street to attract users of all ages and abilities. Why? Because separation matters. It gets into the psychology of a walker and a biker, that we don't want to be in a hostile environment. That's when you start to get into the next level, is that when you reduce that stress, okay, now we might see people be more inclined to utilize the facility, thus increasing physical activity, and then get into the improving health and so on and so forth. And yet, in this instance, you also still see towards the bottom some graphics that can be helpful, again, just kind of, for the layman public and even for, again, decision makers, just because they're inundated with so many decisions and things on their docket. It can be helpful in like an executive summary or something like that to have a graphic and a tool such as this. One of the steps of the importance of monitoring. Because, and it's a cliche in the planning world, but we always talk about that wonderful shelf that has so many documents that collects these industrial, amounts of dust. Well, a monitoring step is specifically aimed at preventing that. And so what you're seeing here is right out of our health impact assessment for the branch library. And in this case, we came up with several steps, and we got buy-in from the city and other organizations that were a part of this HIA on some of the actions that needed to be taken and the frequency for which they were to be, collected, if it's information or meetings, whatever it is. But it really helps to illustrate, hey, this can't just sit around. You have to be proactive, and you have to follow through. And I'll give you an example. We can forecast as much as we want till the cows come home about how many people are going to use a facility, what the economic impacts might be, but that in many cases is our best guess using tools that we have. It's up to our monitoring steps to really determine, was that right? If so, okay, that's great. If not, how far off are we? Maybe we underestimated in some cases. And so it's a very important step that monitoring be put into the HIA. It's required, but also that everybody has buy-in and continues to make this document move forward. A few of the things that we've used is, some of these critical maps. And as Leigh mentioned, while HIA is not necessarily a community health assessment, I would say that for us, we've had success in having an assessment be part of the HIA. Not the whole piece, but certainly it does help us to understand what's happening in various geographies. And so you can see in a document like this coming over from the Seattle area how various categories can come together, create heat maps, for example, on, okay, here are maybe the areas that we're having some problems with. For various reasons, social determinants of health are indicating that, and what do we do about it? And it can be, as the second bullet illustrates, a springboard for other health-related evaluations, design efforts, and so forth. So I'm not going to belabor this point. I think it was made prior, but I would certainly encourage the collection of data and with a geography type of an approach is really a valuable one. So another tool that's been useful for us to a degree is the World Health Organization heat model. If you're not familiar with it, you can simply do a Google search and you'll see what it's about. It was developed in Europe. There is some overlap with the United States with respect to some of the metrics and how this document or how this tool kicks out numbers. But what it really is intending to do is to quantify these monetary health benefits. Why do we do that? Well, there's two pieces of information that HIA really needs to have: quantifying data or quantity data and quality data, and so quantitative data. So we want to really, include those numbers, include metrics, because that's very, very important. But then mix in some of the other parts with the qualification or quality data that gets people to understand the human element of things. But with respect to the heat model, it helps us to shed light on what those numbers look like. If we were to make an action, specifically in that case with walking and biking, what might our reaction be? What's the fiscal impact, for example? And one of the things that we have found with that is the statistical value of human life is a very important factor on that particular calculator. In terms of what the output comes out. And so it's important to do due diligence if you're going to use it and understand that. But one of the reasons why we look at doing ranges is what you see here, is to kind of mitigate against some of that. Say, here's what a reasonable expectation might be with respect to the number of drops of deaths in a geographic area, utilization rates, and so forth. And then kind of a couple of offshoots real quick before I wrap up is, again, just sort of borrowing from some of the tools like the heat tool. You can see here, again, if you're just kind of talking big picture, what might those increases do monetarily? And so this was just something simple that was done for the state of Colorado and can be done pretty quickly as part of an HIA or other things. So the last couple of slides I want to bring up are sort of some offshoots of HIA. because health impact assessment, I can say personally, has played a major part in the work that I have done over the last several years. But it's also, again, been a springboard to looking at things in a different way. It doesn't always have to be health impact assessment. For example, we're doing a couple of projects now that have borrowed from the HIA steps, but have peppered in a few other things. And you can see this community conditions assessment or healthy conditions assessment, where we've looked at a city in a comprehensive way, and we've compiled all sorts of data that we've overlapped, create those sort of heat tools or heat maps where we understand, hey, there are definitely a lot of different issues at play, and we need to go in and investigate with more depth on the field with interviews and so forth to understand really what's happening within those micro geographies so that the cities can and the stakeholders and partners can get in there and actually do something about it. So think of it as almost like HIA and comprehensive planning combined. And so it's been an incredibly valuable process, I think, and it's rooted, again, in the HIA world. Here's just an example that we have found where a bus stop was placed, and then there's no marked crossing on a 5-lane, state highway with about 30,000 cars per day. Well, how do people cross the street? Because they're getting off on the north. Crossing to the south is extremely problematic, and the nearest marked crosswalk is about 2,000 feet in either given direction. And so, my graphic, there we go. We've tried to come up with a graphic that it shows this. If you're trying to go to the doctor by car, here you go. It's pretty straightforward. 10 minutes to drive on either direction, and your visit might be 60 minutes. Well, if that same approach for a doctor visit is 60 minutes, but you have to take the bus, what does that get to with respect to our built environment and equity? And we have folks that may not always be able to have flexibility with their schedules to get to a doctor, an appointment, for example, in a timely fashion, have to take time off. So a graphic such as this can be helpful to illustrate that point. Finally, some success stories, and I'll skim through these kind of quickly. The most comprehensive HIA we did was an 8-county HIA in North Carolina, rural North Carolina, and that was incredibly complex HIA, but incredibly fruitful. And in that instance, the client that we were working for ended up securing funding to actually implement the recommendations for 4 additional years, which was great. Other things, the New Belgium Brewery in one instance paid attention to that HIA and ended up funding design for part of the greenway, or the top priority greenway. We had design changes to the physical layout of the bound crossing library, which is here in Boise. They also totally changed a lot of the programming offerings based on the demographics around it and how to engage the youth and senior populations, which was their focus. The city of Boise is about to initiate an HIA program, essentially, that really looks at health in almost everything that they do, at least to one end or the other. Could be kind of cursory all the way up to more comprehensive. And then for sake of time, I'm just going to kind of zip through a few of these, but some of these things have brought about additional funding, bike racks, and a whole host of other things. And we've actually learned of some other things just last week that were new to us even. And the last slide I just want to impress upon you is, as I mentioned, for me, HIA has been incredibly valuable, but it's been one thing that has kind of been the foundation of or the root system of a big, broader tree, that once you understand HIA and start working in it, you kind of can start to see how it can branch out into other things. And that maybe you can do HIA, maybe you need to do something different, but just the fact that you're utilizing health in planning is a very, very important first start. And frankly, for us planners, it's a reminder that our profession was started because of a call to action from public health crisis back in the early 1900s, late 1800s. So with that, I go ahead and turn it over back to Pam, and we can do Q&A.
Thank you, Chris. Well, I honestly think that was absolutely fascinating. I had no idea the depths to which an HIA went in order to provide that kind of information. One of the questions that we got is there a certification process for conducting HIA, or is there an overlap with walk audits, or can you kind of talk about how people are qualified to conduct HIAs? And this is for either of you.
It's Leanne. I'll go. Well, go ahead, Chris.
No, go for it.
There are trainings sporadically around the country that I hear of here and there. I don't. We offer a continuing ed class through Rutgers University that we usually get folks from New Jersey and New York. However, the best way to get more involved in HIA is to kind of take one on. And it doesn't have to be overly complicated. Like Chris said, you can do a simple desktop or a desktop plus that's not necessarily something that's going to take thousands of hours and dollars to do. And in fact, I think that's where it would be best to start, is to kind of, if there's a project that you think needs health as part of the decision making and it's not already part of it, that would be a good place to start, and see what you can to accomplish as much of a health impact assessment as possible. There are standards of practice, and I know if you're going to do a full HIA, you should look into the standards of practice, but my philosophy is anytime you can bring health to the table and make that part of the decision outcome, it's still something that it should be explored.
My add to that would be just a couple things. Is that one, I believe NACHO, HHO, I can't remember what the acronym. There's so many acronyms in HIA, but that organization, I believe, still has their online tutorial process you can go through, and it's a bit of a certification process. It's mostly these modules that you can get through. That's kind of how I got started. But I will tell you, there's also a much more deeper training that's offered through the San Francisco Board of Health, and I went through that even as a refresher a few years ago. I'd been doing HIAs, but I still thought, you know what, I'd love to still do that, and still was able to learn something. And I can tell you firsthand, we've actually put on numerous HIA trainings ourselves, including one at the American Planning Association conference in Chicago a few years ago. But just providing that training is actually a lot of fun. We try to do all kinds of fun, goofy things and make it just entertaining as much as it is, educational.
Right, and National APA also has an online training course.
So Leanne and Chris, we're getting a slew of questions coming in, and so I want to ask specifically to individually each of you. I've got two questions about screening, and I think, Leanne, they relate to that slide that you showed that had a screening tool on it, and the first is about finding that screening tool and whether it's on your Rutgers website. And when you answer that, you can also talk about how do you describe or determine a final decision when doing that screening step. So the person who's asking this says that usually a plan is adopted wholesale by a governing body. Is the moment of adoption considered the final decision, or is there something later during the implementation of the plan that should be informed by the HIA? Okay, so I'll tackle the screening tool. There's actually several screening tools out there. Even the World Health Organization has screening tools and other tools that you can use for each step of the process, the questions you want to be asking as you do screening or scoping and things like that. Health Impact Partners is a great resource for finding some of those types of resources. We do have some on our website as well. But you may find you want to look at a couple of them to see, depending on what type of project. But they do all basically kind of ask the same typical type of questions. Was that it for screening, or was there another part of the screening question? That was it for the tools, but as far as making a final decision. Yeah. So it depends on what decision-making body. So like you said, if there's a comprehensive plan to be adopted, you want your health impact assessment to be part of the comprehensive planning process and update, whatever that process is, whether if they're doing a new element to a comprehensive plan, like a new recreation element, or they're revisiting and revamping, a 10-year-old comprehensive or master plan. You don't want to be doing the health impact assessment if you're trying to impact the actual adoption of the
of something like a comprehensive plan. You want to do the health impact assessment well before you get to that final adoption. But it differs. If it's not a health impact assessment, it's just say a county looking to do a road widening. That decision may not be made for years, and that's always a tricky part of doing health impact assessment, is when is the time ripe for you to complete a health impact assessment where you can influence the decision making in a timely manner. I don't know, Chris, you want to give 2 cents on when you think the best time to influence the decision making, and when you can say it's
Yeah, to me, there's a couple of things. I mean, number one, on the comprehensive plan side, I think a lot of comprehensive planning processes are broken, frankly, and that the end result ends up being kind of a swath of peanut butter over your whole city, and everything's going to be great and okay, but it doesn't end up like that. And I can just say that firsthand in the experiences that I've had personally. So I love adding health as a major driver to a comp plan process. With respect to the interjection of screening and when you'd want to do a project, obviously the sooner you know something's coming about, the better it is. If a project is already started and now you're scrambling on can we do something, yeah, you still can. The branch library that we did, for example, a lot of stuff had already started, but we were still very influential on the final, specifically the programmatic side, because the building was still to be built, but the program side was still to happen and be thought through. So I really think, and reiterate what Leigh mentioned, is how much time do you have, right? When is the timing? If you have a decision on something that's pending fairly quickly, you might not be able to get to it. If you've got a little bit of a window, that 6 month time frame, then maybe you can get going. We've been helpful, to be honest, where a lot of times public health departments say we just don't have the time, the ability to do it, and that's kind of where we've been able to help out in a lot of ways. And so I wish I could tell you that screening was just totally cut and dry. It's just not. It takes a lot of people to think about it and just come up with a good pragmatic decision and approach if you're going to go ahead and move forward on it.
Yeah, and I will add that when you're doing the 6 steps of HIA, and I meant to put this into my presentation, they're not necessarily you finish step 1 and then move to step 2 and finish step 2 and move to step 3. It's more fluid than that. You may find you're kind of going back and forth between steps. I mean, once you've made the decision to do an HIA, then you move on to the other steps, but you may find something has to change in the scope after you've done parts of the assessment. Because you find a new piece of information that really can't be ignored. So it's definitely an HIA. I think health impacted partners like to say this. It's more of an art than a purely scientific process, because there's going to be changes along the whole way, and it's really kind of even going back. Like Chris showed some great ideas of how to present the information and the pathway diagrams. You may be going back to that all the way through the very end of your recommendations as you're pulling things together.
Thanks for that, Leanne, and I think this is a good time to let people know, if you did not see what I texted out to the audience, we will be posting slides in PDF form on our website later today, and you'll look for those at physicalactivitysociety.org. Next question is for Chris, and I missed that probably while I was admiring your slide that had all those different aspects of health on the the destinations. I like that a whole lot. But there is a question about, you recommended a program related to census and community. Do you recall which part of your presentation you recommended that and what the name of the program was, Chris?
Are you talking about, maybe it was a community commons, which I think that was set up by Tyler Norris, who is pretty high up within Kaiser Permanente down in Southern California, and he probably knows the name Tyler Norris, great guy. I think that's probably the one I mentioned. I hope it's more of a data source, but extremely useful. It takes, honestly, the census to me is a website and a process that is extremely clunky and cumbersome. Community Commons takes all that out of it and is very, very helpful and useful for folks like us who want information quickly.
That's terrific, thanks. And we will also have a recording of the webinar. Well, I should say we are recording this webinar, and then we have to see if we can figure out how to put it on our website since we're using new technology today. I have a question about the impending changes in government at the national level and whether you think that's affecting the HIA climate. Would this be a good tool for communities to have more active engagement in their own, local processes than maybe, say, working at a statewide level, for example?
I'll take that one, and I'm a firm believer that if it's HIA, great. If it's something related, wonderful. But I'm pretty biased, and only because I've seen the process be so enlightening to a lot of folks, because when you do a good job, people realize, wow, I had no idea that whatever's being proposed had such, a magnitude on community health. And, and again, it depends on the topic, but it really, really can range on so many different levels. But health is if you frame it up right, and as I mentioned, that's why we try to use that 7 dimensions model. Health can be such glue for conversations because it's not just, government action or whatever. You know what I mean? It's much more deep. It's much deeper than that. And so, to me, on the local level, if you can use health and HIA as a process or an offshoot of it, whatever it is, I firmly believe that you will end up seeing a lot of good results from doing something like that.
Yeah, I wholeheartedly agree. I mean, I've seen whole conversations change from there's no money from that to we have to make this because it's not equitable if we don't. So, I agree. If you can, and really politics is local. So if HIA is a way to engage folks at the local level. Who knows what's happening with the federal government in the future, but, keeping local folks engaged in health is important as we move forward.
Having said that, I will add one quick caveat to that, though, is that, like, I've worked, in Utah, and many of you may know Brett McKiff, and so their approach, he works for the state, but his approach is that, we're going to make funding available that we do have to local communities and health departments so that they can at least have a bite at the apple and see if it's a useful tool for themselves, and if it is, then they can keep going with it. So I do think that there's a role for state organizations too, and even if you don't have, hundreds if not millions of dollars, and in their case, he's made enough money available to do rapid HIAs and, and again, just kind of try it out, see if you like it, if it's a helpful process for the community.
So I'd like to do one plug for next month. In January and February, we traditionally have moved our webinars to the second Monday of the month because the third Mondays of those 2 months tend to be federal holidays. So on January 9th is our next webinar. We will have speakers who were part of our interviews for the Stories from Small Towns project. Those are towns of 25,000 or fewer that have made changes that result in more walkability or bikeability, whether or not health was their primary objective. And I thought this might be a good time to mention that we're doing that webinar next month on January 9th. Same time, so please mark your calendars. I have another question, Chris, for you. The quick one is, do you have a Twitter profile?
I still do. I kind of tweet. It was at Vitruvian_plan. But now that I'm at Alta, I don't use it quite as much. But Pam, my contact information, I believe, is made available through the webinar. So by all means, if somebody wants to reach out to me and chat, go for it. Twitter or otherwise.
And I think we also had a question about how Boise was going to use the HIA, but I'm suspecting that might be a longer answer than the 2 minutes that we have left. I do have one other question. Yeah, go ahead. Go ahead, Chris.
Real simple. When they wanted to try it out, we did the one on the branch library. Council was very happy with results and said, let's do one on everything. And we said, no, let's not do one on everything. And what ended up happening was we kind of worked with the city and some of their folks and basically came up with a decision matrix on how and when things maybe elevate to HIA. and that's kind of what's being pursued now. So not everything's going to go to HIA, but there will be some more of the substantial things that the city's engaged in that might.
All right, and then I think this might be our final question, and it had to do again with those 7 dimensions of health that you mentioned getting from some entity in Wisconsin. How do you communicate about emotional health to stakeholders when you're talking about planning out of physical environments?
Oh, gosh, yeah, that's a great question. I'll give you a great example on a greenway we did. I was out there doing some observations. The next thing I know, I saw about 25 people get together, and they came out of nowhere. They started to hug and hold hands and bowed their head, and I'm going, what the heck is happening? Come to find out, it was a church group that got together twice a week to simply go and walk Greenway, and they were doing it with each other. They were mostly made up of senior citizens, and if that doesn't illustrate emotional support and emotional health, I don't know what is or what does. But emotions are so important because the mental health linked to those things. So yeah, it's I think you just have to think it through, and you'll find the answer to that. And it's definitely evident in a lot of different ways. Even with our branch library, for example, emotional health can be had on a number of fronts through support and the relationships that people have by sitting down and talking with their neighbors.
Yeah. All right. Well, I want to thank you. Go ahead.
I was just going to say there is research out there that supports even how emotional health affects life expectancy. So it is an important factor, and we find that with stress too. Often people will poo-poo stress as being that important, but when we pull it out in our reports, we can show the importance of how stressful environments have an significant impact on health and life expectancy.
Excellent. Well, Leanne and Chris, I want to thank you for those who are left who are going to fill out the post-event survey. It is a little bit different than our prior ones. It only offered the opportunities to choose from a set of choices. So if you want to email feedback regarding the webinar or future suggestions or the platform of GoToWebinar, please just reply to the confirmation email you got to send to me at pam@physicalactivitysociety.org. And if you're looking for continuing education credits, the certificate is posted on our website on the post that has to do with this webinar. So thank you again to Leanne and Chris. And this concludes our webinar for today.